Okay. So our final presenter is Jackie Sliwinski. And Jackie did her practicum at the Rural Institute for Inclusive Communities. Her site mentor was Caitlin Fratali. And the name of Jackie's presentation is Hepatitis C Testing and Treatment in Montana Needs Assessment. So take it away, Jackie.
Thanks, Lee. Hello, everyone. My name is Jackie Sliwinski, and today I'll be talking about my project, APE project with the Rural Institute for Inclusive Communities. I did a needs assessment on hepatitis C testing and treatment in Montana. Okay, just a quick overview of my APE. So the site organization was the Rural Institute for Inclusive Communities. My site mentor was Dr. Caitlin Fratali, who is the Director of Evaluation and Scientific Research at the Rural Institute. And then, my academic advisor was Lee. Okay, a quick overview of what I'll be going over. First, I'll go through my foundational and generalist concentration competencies, and then I'll move into giving a brief overview of the needs assessment, the goals of the needs assessment, and the methods, a little bit about the data collection, and then I'll talk about my competency products.
So Jackie, we can't see your screen.
Oh,
maybe just recheck that screen share.
Yes, sorry, one moment. Oh, shoot. Sorry about this. Okay. There we go.
All right. Yes. Okay. There you go. Awesome.
Sorry about that.
That's okay. Take it away.
Okay, I'll jump to my competencies. So the foundational competencies that I chose are listed here in this table, along with their products. The first two competencies listed are to assess population needs, assets, and capacities that affect communities' health, and select communication strategies for different audiences and sectors. And their associated product is structured interview forms. The next competency I chose was to analyze quantitative and qualitative data using computer-based programming and software as appropriate. And its product is content analysis Excel worksheets. And then the final needs assessment report for the hepatitis C needs assessment was the product for the last three chosen competencies, which were to interpret results of data analysis for public health research, policy or practice, and communicate audience appropriate public health content, both in writing and through oral presentation, and to perform effectively on an interprofessional team. The two generalist concentration competencies that I chose were to gather, integrate, and analyze descriptive health data from rural or frontier settings, and to identify the common demographic characteristics of rural or frontier areas and their implications for provisions of public health services. And their products were, again, the content analysis Excel worksheets and the hepatitis C needs assessment report. Okay, so the needs assessment had a large focus on the hepatitis C care continuum and the gaps within it. Public health methods for addressing hepatitis C rates rely heavily on effective care continuums in which an individual who's infected ideally moves from an initial screening for hepatitis C antibodies to a confirmatory diagnosis with RNA testing, and then is connected with a provider for evaluation for treatment, and then to receiving treatment and retaining medical care to a cured status. Data from 2018 suggests that 24% of people in the US who are currently infected with hepatitis C are aware of their status. And of that 24%, only 5% are in treatment. So that statistic alone speaks for the gaps within the continuum. It is extremely important for individuals with hepatitis C to be aware of their infection status, receive the treatment they need, and to reach the point of being cured and maintaining that cured status to preserve the health of people living with hepatitis C and to improve the quality of their own lives and decrease the infection rate of hepatitis C. Okay, so the purpose of the needs assessment was to support hepatitis C surveillance, prevention, and elimination in Montana through a better understanding of patient-provider perspectives on hepatitis C testing and treatment processes being used. And so we had 3 goals in mind. We first wanted to understand hepatitis C screening, testing, and treatment processes being used across the state of Montana. And we also wanted to identify and understand the barriers and facilitators in the Montana hepatitis C care continuum. And we wanted to do that in a way that captured the perspective of those serving in different roles along the care continuum. And then lastly, drawing from our research findings, we aim to pinpoint opportunities for enhancing hepatitis C testing and treatment protocols and come up with actionable steps that could be recommended to the Montana State Health Department Viral Hepatitis Prevention Program. Okay, so we use a qualitative approach to understanding the landscape of hepatitis C care in Montana and to assess the barriers to hepatitis C testing and treatment from the perspective of our 4 target populations, which were healthcare system personnel, clinical laboratory personnel, staff members of community-based organizations that offer syringe services, and persons at risk or positive for HCV. These populations were chosen because they are all involved in the hepatitis C care continuum at different points along the continuum. Our data collection included 2 stages. The first stage included interviews with healthcare system personnel, laboratory personnel, and harm reduction program staff. This was called Group 1. The Montana State Health Department provided us with, their surveillance data identified 5 health systems and 7 clinical laboratories in Montana that conduct at least 80% of the hepatitis C tests in the state. And so we wanted to talk to each of those places, and the State Health Department kindly provided us with a primary contact from each health system and laboratory, and also a primary contact from harm reduction programs across the state to help kickstart our recruitment process for Group 1. Our second stage of data collection included interviews with persons at risk or positive for hepatitis C, which we called Group 2. For this group, we focused on people who inject drugs as the primary high-risk population in Montana, because data shows that injection drug users account for nearly 70% of new hepatitis C infections in the US. And this group was recruited through a combination of in-person recruitment and flyers posted at harm reduction programs. In total, I conducted 52 interviews. Okay, so that leads into my first product, which was structured interview forms, and its associated competencies are listed there on the screen. I developed semi-structured interview guides for each target population, and the interview questions were drawn on recent literature just regarding hepatitis C testing policies, barriers, and facilitators. And we also consulted the Montana Viral Hepatitis Advisory Council in the development of interview questions and guiding prompts to really make sure that we're asking the right questions and asking them in the right way to capture the good and the bad of people's testing and treatment experiences, as well as capturing just an understanding of the processes used to test and treat. Interviews with hospital, laboratory, and harm reduction program staff included questions about facility-specific testing policies, their procedures for testing, and questions about participants' experiences in providing hepatitis C and testing and treatment services. And we also asked them about any challenges that they faced in providing those services. Interviews with individuals at risk or positive for hepatitis C included questions about participants' thoughts and reflections and experience with hepatitis C screening, testing, and treatment. We asked them to describe their interactions with providers and any challenges that they faced throughout the testing and treatment process, and to give recommendations of how they think the process could be improved. Each interview guide was developed for a 30 to 45-minute interview. On average, I think they ended up being around 35 minutes each. Okay, my second product is content analysis Excel worksheets, and they are associated with the two competencies listed there. Data analysis was conducted separately for each target population. So each interview was audio recorded, and then the audio recording was transcribed using Otter AI, which is an automated transcription program or software. And then they were cleaned by myself or another member of our research team. And then once the interviews were transcribed and cleaned, I transferred the data gathered from each interview question to an Excel worksheet and analyze the data from each interview question using content analysis to document the topics and themes described by each respondent, and quantify topics and themes to summarize the data. Separate content analysis was performed for group 1 and group 2. The image on the screen is an example of the worksheet for group 1. Over on the right are the interview questions, and then the gray and white columns represent participant responses, and then our coding or theming for those responses. Okay, and lastly, product number 3 was the final needs assessment report. The development of the needs assessment report really began with the content analysis. Using those worksheets, we summarized the testing processes used among the healthcare systems, laboratories, and harm reduction programs, and assessed the processes of each, and then identified barriers and facilitators and recommendations for improvement mentioned from each target population. We found that there is a lack of universal screening in private health systems. There's loss to follow-up between initial antibody screenings and confirmatory diagnosis, and limited resources to testing for harm reduction programs that reach those at-risk populations, along with some other barriers. And then from there, we worked our way out and discussed like what our findings meant and what could be recommended to the state health department viral hepatitis prevention program to improve hepatitis C testing and treatment services in the state. And that is all that I have for you today. I want to thank my site mentor, Caitlin Fertali. She was so great. She was very helpful throughout the entire process, and I learned so much. I would also like to thank the other people on my research team, Mackenzie Javorka and Bridget Whitman. They were great to work with, and I learned so much from each of them. Thank you.
Thanks, Jackie. Nice job.